Good afternoon, folks. My name is Dr. James Sullivan. I'm a family medicine physician, and I would like to do my topic on medication allergy versus side effects, get into what is the difference between those and how to ask the right questions to glean appropriate information. I would like to emphasize the importance of recognizing and discovering and documenting medication adverse reactions. This is a critical step in the safe and effective prescribing of medications. I view the role of pharmacy technicians as an integral part of a coordinated healthcare team, along with my nurses and pharmacists. Adverse drug reaction, or ADR. So an adverse drug reaction, there's two definitions I'm showing here on the screen. Unintended harmful events attributed to the use of medications, or an appreciably harmful or unpleasant reaction resulting from an intervention related to the use of a medicinal product. So basically, I like to simplify that and say anything that happens when a patient takes a medication that is not the intended result. So if I give an antibiotic to fight an infection and they get nausea or a headache or diarrhea, that is obviously not intended. So that's considered an adverse drug reaction. Two broad categories of ADRs. So there are true allergic reactions. Allergic reactions involve the immune system, termed allergies. And then there's non-allergic reactions. These do not involve the immune systems. These are known as side effects. Allergy versus side effects. So allergies, actual allergies to medications are fairly rare. Only about 5 to 10% of ADRs are true allergic reactions. One thing to note, allergic reactions will happen every time the patient ingests the drug after that patient is sensitized. Side effects, on the other hand, are much more common. These are usually what we see when we prescribe medications. They can be predictable depending on what type of medication you're giving. They can happen randomly. So a patient might take a medication and get diarrhea, and then a year later they may have that same medication and nothing happens. So these are what side effects are known for. A good example is antibiotics can cause diarrhea just by the way they work in the body, but that might not happen all the time. So that's kind of a predictable side effect that this medication can do. So how do we tell the difference between an allergy and a side effect? So allergies, again, involve the immune system. So since the immune system is involved, these reactions tend to be systemic. So skin rashes, hives, wheezing, these are reactions that tend to be systemic, or the entire body is reacting. One very dangerous reaction is called anaphylaxis. That's where you have airway swelling, systemic shutdown. Patients can go into shock, and anaphylaxis can be a life-threatening condition. Side effects, on the other hand, do not involve the immune system. Side effects to medications tend to be localized to certain areas of the body and not necessarily systemic reactions. So nausea, vomiting, diarrhea, that's kind of specific to the GI tract. Headache, fatigue, drowsiness is kind of central nervous system, things like that. So some known or expected reactions, some examples, there's a lot of medications that we prescribe that we know will likely, have common side effects. So it depends on the medication. For example, antibiotics, a lot of them can cause diarrhea. And this is obviously because antibiotics not only kill the infecting bacteria, but they can also kill normal flora of the GI tract, which could cause diarrhea. Opioids very commonly cause constipation. Cholesterol medications, statin drugs, commonly cause muscle aches. And then, there's some obvious side effects. Blood pressure medications, they'll lower your blood pressure, that we can lower blood pressure too much. Blood thinners, Coumadin, Xarelto, Eliquis, these will increase your risk of bleeding. So bleeding would be a side effect of taking these medications. Certain diabetic medications, especially the new ones that are out. For example, a family of like Invokana, Farxiga, these medications, the way they work, the patient usually urinates sugar, excess glucose, and because there's glucose in the urine, it can cause urinary tract infections or yeast infections. So again, these are expected or known side effects, common side effects. They're not allergies. We can still use these medications safely as long as we know these side effects. So why is this important to know? So can we continue to use a medication if you're allergic to it? Absolutely not. Again, like I mentioned before, if a patient has an allergy to a substance, they will have that allergy for life unless they go through sensitization treatment. So every time the person gets that substance, they will have that same allergic reaction, and it will likely worsen every time you're exposed. So definitely not, we can't use a drug if a person is allergic to it. Side effects, on the other hand, yes, you can. Again, if we know these are common, and we usually counsel patients, hey, you might experience some diarrhea. You can do some things like take this augmentin antibiotic with food to kind of minimize side effects. If you're on opioids, we tend to counsel patients to use laxatives to avoid constipation. So it's very important to delineate ADRs as allergies or side effects, just because, the more we list medications as allergies, the more limited scope we can have with using medications. So we don't want to limit treatments for people. So I've seen medical records with an allergy list of maybe 10 medications on there that really limits what you can use to treat conditions. But when it came down to it, when you looked into that that allergy list, most of the listed allergies were really side effects. So we can still use those medications. A common one is penicillin. It might be listed as an allergy, but if you query the patient, they might tell you, when I had penicillin, it caused diarrhea. So we wouldn't want to limit the use of penicillin, because penicillin could be the only antibiotic for certain infections. So that's why it's very important to know if an adverse drug reaction is a true allergy or a side effect. And as one thing we should always keep in mind is allergic reactions can be fatal. So how do we get the information we need to get this, to figure this out for patients? So we want to ask the right questions. So I like to usually start with open-ended style questions. So for example, are you allergic to anything? That opens it up. That's a pretty open-ended question. And the patient might list off what they know they're allergic to, etc. Then I would change that line of questioning to more focused questioning. So you say you're allergic to penicillin. What happens to you when you take penicillin? Really be sure to ask about reactions, because just saying they're allergic to something, a patient might not realize that diarrhea from an antibiotic is not a true allergy. That's a side effect. So we really want to know that. So start with open-ended questions, then narrow the focus, and always be sure to ask about the reaction that they had. So it's one thing to get the information, but it's where the rubber meets the road is the documentation. We need to put this into the medical record or the patient profile that you have. That's very important, obviously, for future use. So as a general rule, we want to list drug allergies in a clear, very visible area of the record, or the patient profile should be prominently displayed. Back in the old days when we had paper charts, that allergies were usually a bright color on the front of a record, so everybody could see it and always be visible. It is critical not to miss an allergy. We miss a side effect, that's not as big of a deal, but allergies can be fatal, so we never want to miss an allergy. Again, part of documenting medication allergies, we should always document the reaction. Again, we don't want to limit the scope of medications that we can use for people, and we want to always put in the reaction. And that's the only way we can determine if it's a true allergy or side effect. So as far as a medical record goes, at least, in my clinic, we have electronic medical records. Usually all of the ADRs, or adverse drug reactions, are listed under the title of allergies, which might be a little misleading. So again, like I said in the example, I've seen allergy lists of 10 medications, but none of them were true allergies. They were all side effects. So again, we want it prominently displayed so it's easy to see and right in front of your face whenever you're ordering or dispensing medications to people. Again, always when you document an allergy, make sure you document the reaction that the patient had when they had that certain medication. The most common medication allergies we see are antibiotics. So penicillin being probably the most common of the antibiotics that people are allergic to. Sulfa drugs, Bactrim being in that family, cephalosporins, Rocephin is a popular antibiotic we use in that family. Interestingly, you might have noticed that when someone is allergic to penicillin, we must be careful with prescribing cephalosporins, and that is because there's a 10% cross-reactivity with penicillin and cephalosporins with the molecule. So if someone's allergic to penicillin, we want to be careful prescribing cephalosporins because they could also be, there's about a 10% chance they'd be allergic to cephalosporins. However, it is safe, just so you know, it is safe to prescribe a cephalosporin if the reaction to penicillin was not anaphylaxis. So if they have anaphylaxis to penicillins, then definitely cephalosporins would be contraindicated because just the risk of that 10% allergy, the 10% risk of anaphylaxis is too high. So we want to avoid that. Then common allergies, NSAIDs, so ibuprofen, naproxen, these types of medications are commonly cause allergies. Anticonvulsants, aspirin is a common medication allergy, and chemotherapy agents. So with the advent of electronic prescribing, we have been able to make a marked decrease in prescribing errors. So, and this is mainly due to alerts. So in my electronic medical record, when I prescribe medications, there are many alerts that can fire when I do that. So if I try to dose a medication that's not the usual dosing parameters, an alert may fire, hey, are you sure you want to do this? This isn't the usual dose that this medication is done. And so an alert will fire. There's drug-drug interaction alerts. So if there's medications in the patient's medication list, and I order a medication that might interact with one of those, I will get an alert. So that's why we have computers. They're very intelligent and help us avoid these types of things. And a big alert is allergies. So that's why it's really important to document and put in allergies in the allergy list so that these alerts can fire. So these alerts can be set by the user. So we have heard of alert fatigue. That's where, if we have too many alerts set, it's just going to be, not user friendly. So we want to limit alerts to what is really important. And every electronic prescribing program should have allergies as their #1 alert. Now, as far as these alerts go, the prescribing provider can override these alerts at their discretion, and I do it every day. Again, if I see penicillin allergy, but diarrhea was the reaction, I'll go ahead and still order amoxicillin because that's a side effect and not a true allergy. So that's why we would override alerts in that case. So I view prescribing medications as a team effort for sure. My record that I have at my office could be different than the pharmacy record, your patient profile that you have. It's going to be different, actually. So patients might not be the most reliable sources of information. So there could be disparities in allergy lists and medication lists. That's why we always make it a habit to ask about, do medication reconciliation every time we encounter a patient. So one area that we can be tripped up in is phone orders. So how many doctors' offices call you guys and order medications for patients over the phone? So that person ordering i.e. me, when I'm on call, if I'm out at the mall or something and I get a call that I need to order a medication for a patient, I'll call the pharmacy and I won't have that patient's record in front of me. And if I'm trying to order a medication that they might be allergic to, I always ask the patient, but again, they might not be the most reliable sources of information. So if that's why it's critical on both ends that we have, accurate documentation of allergies. And in my opinion, allergy screening should be done by everyone in the prescribing team, not only by me doing it, my nurses, but also on the pharmacy side as well. And just a reminder, pharmacy technicians are information gatherers, not decision makers. So, you gather all this information about allergies and reactions, but I would recommend you refer to the pharmacist or the patient's physician to, make the decision, is this an allergy or is this a side effect? Is it still safe to use this medication or not? So we love that you do a great job gathering information, but I would defer to the pharmacist in questions like that. So,
Dr. Sullivan, thank you for this great information. A couple of questions.
sure.
If you could summarize for everyone, and if you could just, it's really the meat of your presentation, the difference between a drug allergy and a drug side effect. Could you summarize that difference?
Yep. Again, a drug allergy, again, is a reaction that involves the entire immune system. So they're usually systemic reactions. Examples would be a skin rash, hives, wheezing, so whole body reactions, whereas side effects tend to be localized to areas. So the GI tract is a big one. Stomach upset, nausea, vomiting, diarrhea, central nervous system, headache, fatigue. So these localized reactions tend to be side effects. So,
thank you. During your presentation, you mentioned a couple of times anaphylaxis. Can you kind of describe what that looks like, or give us a little bit more information of what that is?
Yep. Anaphylaxis is a very severe allergic reaction. The most popular anaphylactic reaction tends to be with bee stings. I don't know if anyone's known someone who's allergic to bees. That could be a fatal thing. And it's just the veracity of the immune reaction to that substance. So peanut allergies tend to be anaphylactic reactions. So these are systemic, very severe reactions where your airway can swell and cut off breathing. The patient can go into shock where your blood pressure drops, and you can have multi-system failures. You can have kidney failure. You can go into cardiac arrest. So very, very dangerous. And it usually happens very quickly. So it's always an emergency if you think someone's having anaphylaxis.
Thank you. You because you mentioned peanut allergy, sometimes when pharmacy technicians are interviewing patients and they ask, are you allergic to anything? The patient will start listing food allergies. So do you think that that's something that pharmacy technicians should document, the food allergies, or just kind of only document allergic reactions or side effects to medications?
That's a great question. And you might have seen in your patient profile NKDA, no known drug allergies. So we don't want to limit it to just medications. So anytime you hear of an allergy, food allergy, you could have an allergy to contrast dye. which isn't a medication, an oral medication. So that's always a good idea to be documented, just because there are certain medications that if you have a peanut allergy, we shouldn't use. And it could be, what's in that medication. An example would be egg allergies and certain immunizations. So yes, always document that information and let the prescriber or your pharmacist decide if it's pertinent or not.
Thank you, Dr. Sullivan. Now we have patient interviews that we recorded, and we're going to share those patient interviews, and then we'll look for your feedback.
Are you Priscilla Presley? May I help you?
I am.
Are you here to pick up a medication?
Yeah, I am here to pick up, it's something for my earache.
Looks like it's amoxicillin. Have you ever been on this medication before?
Yeah, I think I have. I'm just not quite sure. I maybe have been in the past.
Okay. I saw on your profile that you're currently on metformin, 500 milligrams twice a day, and Lipitor 20 milligrams once a day. Are you I see that there's no drug allergies listed on your profile. Is that still true?
I am allergic to penicillin.
Oh, you are?
Yeah.
Okay. Let me, do you have any known medical conditions that we need to know of?
You mean related to my allergy or just medical conditions at all? I think I'm pretty healthy. I do pretty good on my medications.
Okay. Okay. Usually if you're on usually if you're allergic to penicillin, you probably would have a allergic reaction to amoxicillin as well. Would you like to speak to one of my pharmacists about this?
I mean, can I go ahead and just can you give me my amoxicillin today, and then can I just talk to a pharmacist later?
No, I feel like you should talk to him about this before you leave. I just want you to be aware of the what could happen if you take this medication if you're allergic to penicillin. I would rather have him talk to you about this before you receive your medication.
Okay, well, now that we're talking about it, I really have muscle aches a lot, and so I wonder if I'm allergic to one of my other medications too.
Well, with you being on Lipitor, that is a common side effect to that medication, is to having some muscle aches. But if you're allergic to penicillin, I really believe that you really need to speak to my pharmacist about any kind of potential risk that you could have if you take this medication.
Okay, I understand.
Hello, Priscilla. My name is Shirley.
Hi, Shirley.
Can I help? What can I do to help you?
I'm here to pick up medication, and someone called me and said that they maybe had some questions for me, that they wanted to talk with me about my medications for a little bit.
Yes, if it's all right with you, I just have a couple of questions to ask. Can you tell me what medications that you take?
I take, let's see, a statin drug, and then I take something for my for my blood sugar, and those are the only two that I take.
Okay. Yes, I see here that you take Lipitor and metformin, and the Lipitor is for is your statin, and the metformin is for your blood sugar. Can you tell me if you have any allergies?
I do. I'm allergic to penicillin.
You are allergic to penicillin. All right. Thank you. The drug that you have come to pick up is amoxicillin, and it does have a connection to penicillin. So I am going to have you talk to the pharmacist before we give you the medication. just to make sure that there's not any contraindications for you to take this drug, if that's all right with you.
Okay. Yeah, sure. I don't really have time today. Could I just go ahead and take my medication home and then talk to the pharmacist another time?
Well, our policy is for you to talk to the pharmacist anyway before you receive a new drug. So I will go get the pharmacist right now and they will come talk to you. It'll only take about 1 or 2 minutes, if that's all right.
Okay, yeah, I guess that is a good idea because I have muscle aches, and so maybe I'm allergic to one of my other drugs too, and I didn't even know it.
Okay, well, if you'll just wait right here, I will go get the pharmacist and have them come speak to you.
So if you came into my pharmacy, Miss Priscilla, and asked to pick up your prescription, I would pull up your profile and you have no drug allergies listed, but I would ask you still if you have any new drug allergies, any new known drug allergies.
I do. I'm allergic to penicillin.
Awesome. Do you know what happens, like what the penicillin causes you to do, what kind of reaction you have?
I just get these really itchy hives over most of my body.
So it looks like they've sent you an amoxicillin. And since that causes an allergy, I'm gonna have to go get the pharmacist and talk to them before we can get this medication filled, for sure.
Okay. I'm kind of in a hurry. Can I just get the medication, go home, and then call the pharmacist in a couple days?
Well, how long have you had this allergy? How long have you been allergic?
Man, it seems like I had some penicillin maybe 5 years ago, and that happened. So that's why I knew it would be okay to take amoxicillin since it's not penicillin.
Well, it's still in the same family, so there is a possibility that you would still have that same reaction. So if you'll give me just a few minutes to go talk to the pharmacist about it, and then we'll come back.
Okay, I guess that might be a good idea because I don't know. It seems like I have muscle aches, so maybe I'm allergic to another one of my medications that I take.
Yeah, that's a possibility. So let's get the pharmacist.
Okay, I think the individuals did a really outstanding job of the patient interview. Mainly, they did great examples of open-ended questions for the patient. So questions like, have you been on this medication before? What medications do you take? Do you have any allergies? Those are great examples of open-ended questions that you want to elicit a good, accurate history from the patient. So that was a great job. Also, I want to point out they were really good in that despite having no allergies listed on the patient profile, they still asked about it, and the patient did reveal, a penicillin allergy. So really good job of getting to the bottom of a good history. Also, another question that was asked that was critical is, okay, you're allergic to penicillin, what is the reaction you had? So very good history taking to get that reaction. That way the pharmacist can decide, is this reaction a side effect or is it a true allergy and it would be unsafe to dispense a medication? So very good job of using open-ended questions, drilling down to more focused questions, also getting a good history and asking the question about allergies despite there's no allergies listed on the patient profile. So very good job.